Tamil Nadu is a unique state where all the services are integrated. For example, the primary health centers under Director of Public Health. Actually, the PHCs have dual control. One is the Government of Tamil Nadu, Director of Public Health, and other Director of Medical Service. Then Director of Medical Service manning the non-medical college hospitals. And Director of Medical Education manning the medical college hospitals. The integration means a person can join any of this system. Initially they join the PHCs. Then after postgraduate qualification they go to the headquarters hospital, or they may come over to the medical college. In fact, they want to go back means also they can go back. Whereas in Kerala it's advanced in many aspects. They are a separate service. They have to be recruited by their Public Service Commissioner recruit board. So they cannot go from one board to another, and here seniority is maintained. And a person job, the MBBS join PHC, he can retire as a HOD after his PG qualification, join medical education, and he retires as a HOD, can retire as a professor or HOD in the concerned department, and that gives them a professional satisfaction. So far, all the medical students joining the medical service, many of them join the medical service. Earlier, they used to go abroad. Some students, after finishing the ECFMG and all. Now that the choices are limited, and even Middle East and all that became restrictive, they come with a mindset of joining the medical service, government medical service for some time, and so happen they want to acquire a PG qualification. So here there is a reservation for the postgraduates who are doing the government service, so they go and work 3 years in the primary health centers. Then after that, acquiring the PG qualification, they go to the district, and more, see, 24 medical college means every 1.5 district has got a medical college. So they go to the medical college and serve as a teaching faculty. So in the end of the bargain, they come to a conclusion, they continue. Pay is quite adequate, attractive, and they also can have a consultation, and they can serve the public in the extra duty hours. So they continue to serve till the retirement. And very few dropouts are there due to some circumstances. The introduction of the NEET, both undergraduate and postgraduate, it impact on the Tamil Nadu public health service as well as delivery system is going to be disastrous, and it's splintering the service. Because earlier people come with the medical college, at least they will find placement in the medical college, government service. Now with the NEET, it's so much of earlier, all set of students throughout Tamil Nadu, 97% are from the plus 2 system. Here NEET 3% is only from the CBSE. So many, and the syllabus NEET examination based on CBSE. And they have to undergo coaching 2 to minimum 3 lakhs per individual. That is the minimum. And many students who cannot afford this will drop out. So these students, when they enter the MBBS, may not have the mindset, leave the question of bond and all that, of entering the Tamil Nadu medical service. Then after they pass out, and with so much of self-financed medical colleges and all that, they will join the postgraduate course on DNB and all that. Whereas earlier, all these doctors were depending upon the seats offered by the Tamil Nadu Government Medical Health System. So they compulsorily they go and work 3 years in the PHCs, and then when they find placement, they will come out to medical college at this headquarters hospital. So all the PHC, many of the districts or the PHCs are having a specialist treatment given to the poorest of poor, anytime they can access. It is entirely different from standards. A student who has got a ability, innate efficiency, intelligence. So a minimum criteria laid down, and earlier time they used to pass out and become eligible. Whereas standard means actually when a person for a medical student, the medical institution imparts standard. Even however highly profile a student may be, it is the medical college institution teaching faculty which imparts standard. For example, I can give an example both abroad and India. One Benjamin Curson, who is a very famous neuropediatric surgeon in America, United States of America, he is a pioneer in doing the hemispherectomy in the intractable fits. And he comes from he's Afro-American, comes from a broken family and indulged in some juvenile crimes. He was freed from that and he had an opportunity to enter the medical college. There his standard was developed, became a famous neurosurgeon. Even Tamil Nadu, if you take, there's one Dr. R.P. Shanmugam, who first did in 1996 liver transplant, successful liver transplant in Stanley Medical College Hospital. So he comes from a very backward area like Viluppuram. He did his SLC and that is pre-medical in Thiruvarur and joined medical college, is given opportunity. He is shown as a hepatic surgeon. So when Dr. S. Vaidyanathan, cardiologist, coming from honorary background in South Arcot district, college education, school education, became joined Madras Medical College, became an eminent cardiologist. So standard will come only later. How the individual develops, institution develops. So after many of the doctors may not prefer this PHCs and its headquarters. They may prefer to go to corporate hospitals and work or develop their own private practice and their mindset will be there. Unlike the doctors who come out of the government medical colleges. I'll first come to another school, Ramnath Government School. 2 years earlier, for 2 or 3 years, every year 5 to 6 students, because of their own effort as well as their teachers and community efforts, used to join government medical college. Now this has come down. Come down means actually no student. At whole last year, only one student, I think, instead of the usual 30 to 35 students, one student only got admission in the government institution. And as for my school concerned, other schools, government school or government aided school, the entry into the science group has dropped by earlier 100 minutes, now it has become 75 students. Earlier, even from my school, some doctors found entry into the medical college. In fact, you know, this the popular Dr. Emmanuel is coming from that scan. They got a scan. He is graduated out of our school only. So this may not be the case in the future. See, that's why these coaching centers make money. But for the students, for most of our students, it is the mother tongue, they will be proficient. And to train, and most of the first time graduates and all that. And the parents may not be in a position to help them. To train them in English, competitive exam, that too, this MCQ and all that, it requires specialized coaching. And in fact, it cuts off from the natural ability to learn. Something like a learning disorder will come and it becomes artificial. And normal student with so much of intelligence like Anita and all that, they may do well in the older system, not in this present system. Manpower is the most important. Of course, naturally a student wants to become a doctor and all that blocked. But after 1 or 2, if this students become, I hope need does not continue, that continues and a new batch of doctors come, we read in papers, Children's Hospital, they implanted a pacemaker a few weeks earlier and 10 years it has to be replaced. Then Tirunelveli Medical College, they have done this one heart tumor removal, so many important operations which a common man cannot afford in a corporate or a private sector. And who will do it after this, in Tamil Nadu, the government system is without doctors properly qualified, that will be privatized. And I think people at large are losers. Possibility is there, as of now is there. But once, as I told you, now doctors who got a urban background or who are coming from Delhi to spend lot of money because the self-finance college is an important factor. Spending so much of money and all that, they want to plow back their money. So they may not prefer a PHC or a village where it's a human tendency. Whereas in a government service, they'll be compulsorily posted to a village. There will not much scope for private practice and all that. So that will be a great effort. Quarters could be given. Then the children should have access to good school nearby, and all where the family can live happily. Go on repeating, your skills become less, your knowledge becomes less. So they have to continuous medical education, not in theory, in practice they have to follow.